Hello everyone. Today our classes we are going to discuss about on how to pass your council exams, and this is a free online classes for you guys in order to see or to know how the council they use to settle their questions and how you have to answer those questions. As always, Al-Faruk Academy presents you these classes in order to support you in passing your council exams and achieving an excellent academic career. First of all, you have to put this in your mind that you can pass these exams because people pass it every year, and not because they are genius, not because they know everything. They pass this exam because they prepare early, they practice regularly, they believe they can do it. So if other people can pass it, why not you? So this academy will prepare you early and will allow you to practice regularly so that you can pass these exams. So what we are going to discuss or what you are going to learn in these free classes, we have 2 days pre-classes. Day 1, we are going to talk about step-by-step approach to passing every stage. As you know, the council, it is organized in stages. We have stage 1, stage 2, and stage 3. Stage 1, it is 3 months. After the 3 months, we are going to carry out exams and go for a break. Stage 2 also is 3 months. You are going to have an exams and also a break. Then you return back for stage 3. So in today's lecture, that is day 1, we are going to see step-by-step approach to pass every stage. And also under this, we are going to see study timetable and revision plan. Also, we are going to discuss about how to answer questions correctly, and under how to answer question correctly, we are going to talk about time management because it is very important to manage your time during the exams. On day 2, that is tomorrow, we are going to discuss about mistakes to avoid in exams. Sometimes you know the answer, but some mistakes will lead you to not getting the full marks. And also we are going to discuss about Mlscn topics, that is the topic for the foreign graduates, and also the past questions in details. Day 1, we said we are going to talk about step-by-step approach to passing every stage of the council exams. So the first step is get organized before you start. So you have to organize yourself at the beginning of the program. How to organize yourself? One is to download the syllabus and exam format, the exact topics that council used to teach before the exams. So these topics or syllabus or the courses, Al-Faruk Academy provide this syllabus for you, all of them, with detailed explanation. Treat this as your checklist. So treat this syllabus and exam format as this is my checklist that I'm going to go through. I have hematology, histo, microbiology, parasitology, chemical pathology, so I have to make it as my checklist. Number 2, collect past questions and marking scheme if possible. So also Al-Faruk Academy provide all the past questions from 2018, that is the beginning of the foreign graduate retraining, until 20 or 25, that is to date. If possible, also marking scheme, at least 3 to 5 years, but we have provided all the past questions and they are well answered. An approved textbook per subject, but here you don't need a textbook, mostly because the topic are selected and they are the topic that the council they put in the curriculum and are well explained. by this academy. Make a single master calendar with exam dates, registration deadline, and clinical practical revision session. So at the beginning of the program, you have to have a master calendar. Master calendar, for example, I have stage 1, stage 2, and stage 3. In stage 1, I have 5 disciplines, for example, hematology, parasitology, histo, chemical pathology, and so on. Also, registration deadline. Because after stage 3, when you pass the mock exams, that is the stage 3 exams, you are going to register for council exams. And usually, council used to give only 1 week for registration, not more than 1 week. So, some of our colleagues, they sponsor themselves. And some of our colleagues, they have family. Even if you are sponsored by your parents, you have to notify them the deadline of registration. So by making a master calendar, you will be able to know the deadline of the registration. And imagine the money that you are going to pay for the exam is 200 plus. So telling you that to register within 1 week with 200 plus is somehow difficult if you didn't arrange for it. The next thing is you have to build a study plan. For example, build a weekly structure study plan. Monday to Friday, you are going to carry out main study, at least 2 subjects per day. For example, morning, you are going to read microbiology. Afternoon, you are going to read parasitology. And this may not work for each and every one of us. For example, some people, they prepare to read at the evening. Some people in the night, while other people early morning after waking up. So at least read 2 top subjects per day. On Saturday, that is the weekend, try to carry out some practicals and past questions. Bench practical skills practice. That is, you are going to watch demonstration of the practical and try to apply what you have learned on the bench. We have exhibit stations. In council exams, they used to bring some pictures. We call them exhibits. Almost 10 pictures. These pictures, they include the Giardia tropozoites, eggs of the hookworm, eggs of the Schistoma hematobium. Maybe they will bring a picture of mosquito for you. So you have to also revise those exhibits. They will ask you identify the exhibits and give at least one of its uses. Then also revise past questions during the weekend, that is on Saturday. On Sunday, carry out revision and also rest. Review summaries and flashcards. Review what you have read in that week and also what you have summarized in the flashcards. Then you have to light rest for the brain. For the guys, some of the guys, they used to go and play football. For the girls, they used to watch movie to make their brain refresh. The next thing is you have to create a daily timetable, and this daily timetable is flexible. Each and every one know how he used to read. For example, this is just an example. From 8 to 9:30, you are going to study the topic, take notes, and also read them. 9:30 to 10, you are going to make an active recall. That is, close the book, write what you have remembered. What you have studied within 8 to 9:30, you close the book and also write what you can remember from what you have read. From 10 to 11, you can check past question from the topic. For example, I read gram staining technique. So I have to check the past question, whether MCQs or essay questions, where they used to ask gram staining technique, how they used to ask gram staining technique and answer the questions. 11 to 11:15, I will take a break. Then 11:15 to 12:30, I can study the next topic because we said at least 2 subjects per day. So we repeat the same thing. The next thing is you have subject rotation. It's not like you have to read only one subject throughout the week. No, you have to rotate. Even during the day, you have to rotate. For example, Monday in the morning, you can read hematology. In the afternoon, you can read blood transfusion. Tuesday in the morning, you can read microbiology. Afternoon, you read parasitology. Wednesday, clinical chemistry in the morning and immunology or serology afternoon. Thursday in the morning, you read histopathology. Afternoon, you read cytology. Friday, lab management in the morning, while afternoon you read safety and quality control. So this is how you're supposed to be rotating the subject. It's not only that you have to read one subject within or for the whole week. Then we have what we call revision plan. Week by week, you have to put a revision plan in the program. You know that stage 1 is 3 months. So this is just an example. For example, week 1 to 2, you can study the all major topics once. You read them all and make a 1-page summary per topic. For example, in micro, if you read gram staining technique, then you summarize the gram staining technique in 1 page. If you read parasite of medical importance in parasitology, you summarize it in 1 page. Do topic-based past questions. Also, within that 1 to 2 weeks, you can undergo topic-based past question. That is, what you have read, the topic that you have already read them, you check the past question. What are the questions? How they used to ask the question on that topic. Week 3 to 4, you focus on weak areas. We know all we have some weaknesses in some subjects. Some they will tell you that I'm very weak in hematology, while others in parasitology, while clinical chemistry, while others in micro. So week 3 to 4, you have to take your weakness area and study them very well. Also, you can do mixed question sets. That is, not only topic-based past question. You check all the past question. Week 5 to 6, complete all subjects. Make sure within 5 to 6 weeks, you have studied all the subjects. Also, full past question every Saturday. Every Saturday, you have to revise the past question. Full exhibit station practice. Also, every exhibit, you have to be studying them and practicing. The next thing is week 7. On week 7, you can carry out exam style revision. That is, you put yourself in a condition that you are just writing the exam. You pick, for example, a past question, 2019, 2018, 2021. You try to answer those past questions within the time limit the council they used to give. Also, that is for short notes. Past question only. For example, you can just read the short notes. You can read the past questions only. Light studying. That is, you are not going deeper on week 7 because you have already summarized them. While the final week before the exams, you have to sleep, rest, and eat normal. It is very important. If you didn't sleep well, you may end up having some problem during the exams. I can remember one of our colleagues, he studied all the night. He came for the exams. Very unfortunately, during the exam, he is dozing. Imagine. So it is very important for you to sleep, rest, and eat normal. Light review, that is the summary only. What you have summarized, one topic per page, you have to review them. Avoid new topics. So it is very important you should avoid new topic on the final week before exams. Because adding new topics, it may got you into to become more stressed or to forget what you have read before. So it is very important to avoid new topics. Then number 3, we have study method that actually works. We are all different. We have different study methods that we use to read. Some people, they use active recall. Well, after they have read, they close the book and write what they can remember. While others, they have spaced repetition. Review flashcards on increasing interval. That is, after they summarized the topic, then they will be reviewing them, reading them again through and through until they memorize or they understand them very well. Other people, they read as a practice under exam condition. After they have read, they will bring a past question and try to solve the past question without looking into what they have read. We have teach someone. Other people, they read as they are teaching someone. Explaining a topic aloud exposes gap quickly. For example, some people, they used to read loudly as they are just teaching someone. Make a high yield note, but it's very important. Some people, they used to just summarize. So some people, they used to summarize the topic. After they summarize the topic, then they become and read the topic after summarization. So it is very important to know which study method works for you best. We have practical strategies. So during the practicals, list every practical skills in the syllabus. As we know, hematology, they have their own practical. Chemical pathology, they have their own practicals. Micro, histo. So I have to list the practical in each subject. Although you are very lucky, the practical, they are not many. You can cover the practical from the stage 1 if you want. So watch expert demonstration, then repeat on bench. You can watch the YouTubes, how to prepare, for example, the Mlscn, how to prepare a blood film. Then you come and apply on the bench to see if you can prepare it. But usually the council exams on practical, they are not focusing well on your handwork. They used to focus on what you have write. So writing is very important during the practical, although you have to carry out the practical. Then number 5, we have viva or oral exam preparation. You also have to prepare for the oral exams. Prepare concise answers, 30 to 60 seconds answers for common viva proofs. Explain this result. For example, they can ask you to give you a result. Explain this result. List the causes of so disease. List the qualities control step. Troubleshoot an error. They can ask you. So you have to prepare how to answer these questions. Practice with a partner who asks random follow-ups. You can also practice with your colleague. He asks you a question, you give him answer. You ask him question, he give you answer. So whenever you are answering the viva question, try to answer it in a structured answers. Like if they ask you, try to give definition first, then causes, then lab findings, and so on. In practical, in the Bible, be honest. If you don't know, say I'm not sure, but I will check it later, and describe how you will find the answer. It is very important. If you don't know, just tell them that I'm not sure. Or, please sir, can you change the question for me? I can remember during the Bible, there is one student, they asked him about the color of the Combs reagent. And he said, I'm not sure, sir. They said, okay, how are you going to find the color of the Combs reagent? He said, I can go to the donor clinic to check it, or I can go to the hematology lab to check the color. During the Bible, they asked him to go to the lab and check the color and come back. And he went there, he checked the color, and he come back and tell them the answer. So it is very important to be honest. Don't guess during the Viva. The next thing is we have the theory exam tactics. So whenever you are carrying out theory exams, read the question fully, underline the keywords like write short notes, write in details. It is very important. Eliminate obviously wrong choices first for MCQs. For MCQs, you have 5 options, A, B, C, D, E. So whenever you are doing or you are answering the MCQs, try to remove those that are wrong. Clearly they are wrong. Also, it is very important to manage your time. Leave the hardest 10% for the end, flag them and return. So it is very important for you to manage your time. If the question is very hard for you, leave it and start with the easier ones. After you finish the easier ones, then come back for the hardest one. Do a quick answer check if time remains. Whenever you finish your exams and there is remaining time, cross-check your exams. Cross-check your answers. You may find out there is some spelling mistakes or there is some units that you have to correct them. So it is very important to cross-check your exams. And very important to avoid changing answers, because your first answers are 80 to 90% correct. So avoid changing answers. Then number 7, we have practical day and exam day checklist. Whenever you have exams, try to bring your ID cards, admission slip, approved calculator, pens, lab coat if required, sealed gloves, marks if specified. So it is very important when they ask you these are the requirements for the exams, try to bring them. Because whenever you didn't bring any of the requirements, they may not allow you to enter the exams. Even if they allow you, you are going to enter last. And this can lead you to be in a stress and confusion, which may lead to forget what you have read. So it is very important to bring the requirements to the exams hall. Also, you have to stay healthy. Sleep well 2 nights before the exams. Stay hydrated. Light balanced meal. Avoid cramming on the morning of the exams. It is very important. Some people, they didn't read so topic. Then when they come to the exams, we think this topic will come out. Okay, you will start cramming the topic. It may lead you also to forget what we have read for the whole program. So it is very important to avoid cramming morning of the exams. Mindset. Should breathe exercise before starting. Whenever you come to the exam hall, you sit on your chair, then you have to short breathe to calm down before you start the exams. Also, read the instructions slowly, very carefully also, because sometimes you may see that they ask you answer 5 questions, and the questions they are 7 or 6. If you didn't read the answer very carefully, you may end up answering the whole 7 questions, wasting your time. So it is very important to read the instruction very well. Also, in MCQs, they give an instruction that you put T or F behind the options, because the MCQs you have to answer each and every option. So you have to read the instruction very carefully. We are going to show you how to answer the MCQs in the next day, that is tomorrow. Then you have what we call common high yield topic to prioritized. You know that each and every subject, for example hematology, they have specific topic that constantly they use as question in them, so you have to prioritize that topic. Also blood transfusion, microbiology, and this academy, they have already prepared such topics, and we are going to show you how you can get access to that topics and also past question tomorrow, that is for the online classes of tomorrow. Then we have what we call the final week. So what to do in the final week? You have to carry a light revision of 1 page summary only. What you have summarized, you have to go through them. 1 short practical run through each day, and sleep and eat normally. Avoid new topic. So these are the step by step in order to pass your all stages exams. The next thing is we are going to learn how to answer questions correctly. So it is very important to answer those questions correctly. Firstly, for you to answer the question correctly, underline the keywords. Read the instruction carefully and underline the keywords. Write in details, short notes, causes, interpretation, except, life cycle. Next step, they may ask you, write in details on malaria, or write short notes on toxic granulation. So it is very important to underline the words. It is in details or short note. Is it interpretation of specific results? Is it the life cycle? Because this word changed the answer. Example, write in details on malaria is different from write short note on malaria. Then the next thing for you to answer the question correctly is identify the topic and clue. Ask yourself, what subject is this? Whenever they ask you, whenever they say it, for example, this is the question. So there is some clue given in the question. Sometimes it is just a scenario. The scenario may highlight where they pick the question. For example, if they give a scenario that there is a patient with low hemoglobin and high MCV, it is indicating in which topic? In microcytic anemia. If they present a scenario that there is a patient with a fever, rigor, malaria endemic, it is indicating that the question comes from the malaria. So once you know the topic, answer become easier. The next thing is use a standard structure for written answers. So whenever you are given answers, write it in a standard structure. Structure makes your answer organized and examiners loves it. For short notes, if they ask you write a short note, start with the definition, then etiology or causes, pathogenesis, that is mechanism, clinical laboratory features, diagnosis test, management, treatment, complication. So write it in a structured answer, in an organized way. Even if you don't know everything, even if you don't know these steps, how you organize them. For example, I know the definition, I know the causes, but I don't know the mechanism. I can jump to the laboratory features, diagnosis, treatment. Even if I don't know the complication, I should leave it. But I have to put it in a structured way. Then the next thing is write only what is needed. No stories. Write what is needed. So whenever they ask you, be short, direct, and scientific. You can use bullet points. Avoid long paragraphs unless they ask you write in details. So you are very lucky that council, they used to ask direct question. They would just ask you write short note on toxic granulation, write short note on malaria life cycle. So it is very direct question. but you have to write it in a short, direct, scientific way. For example, this is a bad example. For example, the question is write short note on malaria. Then, if you start, malaria is a disease that affects many people and it is caused by mosquito and is very painful. This is how layman is going to describe malaria. And you are not a layman, you are a potential scientist. So answer them in this way. This is a good example for the answer. Malaria is a parasitic infection by Plasmodium species, widely transmitted by female Anopheles mosquito. Clinical features: fever, chills, anemia. Laboratory diagnosis: thick and thin film and rapid diagnostic test, that is RTD. So this is more scientific and direct and short answer. So don't write stories. Write what is needed. Then the next thing is choose answers by elimination in case of MCQs. So whenever they ask you in the MCQs, when you see options, remove those that are clearly wrong. Then when two options remain, between the remaining two, focus on the key words in the question and you can get it correctly. Example, except. The word except, choose the one that is not true. This is what we mean by except. Most errors in exams happen because people ignore the word except or not. So it is very important to note the word except. And this word except, it allows us to divide the MCQs into two. And tomorrow you are going to see the two types of the MCQs that normally council used to ask. Then we have what we call time management. It's very important. For short notes, start with the easy ones first, flag the difficult ones, and return at the end. Don't spend too long on one question. Don't spend just the 1 hour answering one question. If you know only half, write it and you get the half mark. It is very important to manage your time during the exams. The council exams, they used to give 3 hours in practical exams, 2 hours 30 minutes in theory exams, 1 hour in MCQs. So MCQs, it contains 100 MCQs and it is 1 hour. That is, they need you to answer each question in less than 1 minute. So you have to manage your time. While in the theory questions, they give 2 hours 30 minutes. 2 hours 30 minutes, it is almost 150 minutes. 150 minutes. So when you divide 150 minutes into 5, because they used to ask, you have to answer the 5 disciplines, you may end up to see that each discipline you are going to spend only 30 minutes. So you don't have to spend more than 30 minutes in one discipline. And one discipline, you have to answer 4 questions. So it is very important to manage your time, to know that each and every discipline, you have to spend specific social time. Okay? So let us see a short note example of exam formats. For example, if they ask you, write short note on hemolytic anemia. Short note on hemolytic anemia. Answer them in this way. The definition is premature RBC's destruction. What is the causes? Intrinsic causes, that is example G6PD anemia, or extrinsic causes, that is autoimmune hemolytic anemia or drug-induced hemolytic anemia. Laboratory features of the hemolytic anemia: increased bilirubin, decreased retic count, increased retic count, decreased haptoglobin. Test to diagnose hemolytic anemia: comb test, blood film. Treatment: treat the cause of the hemolysis and transfusion if needed. So it is very clear, short, and you will score the high marks. So this is just an example on how to answer the short notes. Then we have The viva or oral question method. When examiner asks you, don't jump directly into the answer. Think like 3 seconds and then give a structured answers. For example, when the examiner asks you, what is toxic granulation? You don't have to just jump into the answer. Toxic granulation is morphological changes in the... No. Take a deep breath slowly for 3 seconds, then answer it in a structured way. It's a morphological change in neutrophil seen in severe inflammation, infection. Dark cause granules in cytoplasm of neutrophil indicate infection or sepsis. So also in viva, your confidence and calmness is very important, because whenever you are not calm, you are not confident, so you cannot answer the questions within the time limit. So when you realize this answer you give for toxic granulation, you answer the question within 20 to 30 seconds. So we are going to see a quick summary of how to answer the questions correctly. Firstly, you have to read slowly, underline the keywords, read the instruction very carefully, identify topic and clue, use a fixed structure, that is, when you are going to answer it with definition, causes, features, test, management. Be short, scientific, and use bullet points. Use elimination to choose the answers. So thank you very much for listening to this lecture, and I wish you all the best, and let us meet for the tomorrow classes. I hope you enjoy the classes of today.